Hello, Facebook. My name's Dr. John Robinson.
And I'm Dr. Christina Bosch.
And sometimes, every once in a while, we're known as
the Sex Docs.
The Sex Docs. Here we are. It's Tuesday, 12:30. We're a little bit behind here today. But 12:30 on Tuesdays, we're here to entertain and enlighten you on all kinds of things about health and sex and fun and life. And today, we're going to talk about Hashimoto's. So last week, this is the third of 4 episodes specifically about thyroid. And today, we're going to talk specifically about Hashimoto's and Graves' disease and these autoimmune conditions. Really excited about it.
Yeah, absolutely. All right, let's get started.
All right. So, well, before we do, we have
housekeeping.
We're always going to do the housekeeping.
My favorite chores.
I actually like these chores. So, first of all, share the video. Please, we want to encourage everyone to share the video. Put on notifications so you know. Remember, you can ask questions of us during this whole live presentation. And, of course, you can contact us in the future and ask us questions. So this really gives you an opportunity, if you're seeing these live presentations, to really see what's going on with your own health and how it might apply to you and your loved ones.
Yeah.
So share the video, turn on the notifications, and for next week, we will definitely be talking about thyroid again, and that'll be about thyroid and weight loss. So that'll be kind of rounding it all up. So let's get right into this today. Hashimoto's or Graves' disease, do I have either? Let's figure it out. Did I mention to share the video? Did I say that?
I don't think so.
Share the video. Definitely share the video. Okay, so Hashimoto's symptoms. Now, so last week we talked a lot of detail about all the symptoms of low thyroid quite a bit, and we do see more low thyroid than we do hyper or high thyroid. So we talked about that last week. If you want to go back to that, we would encourage you to check it out. But the symptoms are a little bit specific for Hashimoto's.
So when we're thinking of Hashimoto's, again, think about that low functioning thyroid, hypothyroid. And then also as we go through this, just as a reminder that just because it's hypofunctioning does not mean that the person is always overweight. It could be that they're just noticing a difference in how easy it is for them to maintain their body shape or to lose a little bit of fat, they do gain it. So you're thinking about a sluggish system. You're thinking about a person that's having a fatigue and difficulty with the throat, perhaps some congestion, some swelling, difficulty swallowing, hard time expressing themselves.
Right. So what would be some of the differences? Again, we went over all that last week, but let's make sure we're talking specifically about the difference between Hashimoto's and just say regular or low thyroid.
Okay, so as you can see on the list here, especially over here where we're talking about the throat swelling and the choking, this is a really important part of it because you're literally having an autoimmune reaction to the thyroid located in the throat. Whenever you think of an immune reaction, you think about inflammation. So there can just be some congestion, some swelling, discomfort in the throat.
I was trying to communicate to Christina about something, and I was doing it under the table, so to speak, here, and she poked me back.
Stop it. Let me be.
Maybe that. Anyway, so where were we? We're talking about this. The differences here are the swelling. You kind of got into that.
That's what I said.
So the swelling. So let's talk a little bit about the Graves' disease. And remember, that's high thyroid. So both of these are autoimmune conditions. Remember, self. It's your own immune system attacking your thyroid gland in this case. One case can lead to high thyroid. We call this Graves' disease. Another situation can lead to low thyroid called Hashimoto's. But so for the high thyroid, look, this is a medical emergency. And most of the cases for hyper-high thyroid is going to be an autoimmune process called Graves' disease. Fast heartbeat, shaking, tremors, unexplained diarrhea. It's like you had 50 cups of coffee and it's not going away. And because it affects the heart the way it does, again, this makes it a little scary.
And I want to take a moment to say 2 things about this before we turn the page. The first one is a lot of times patients that are hypo-functioning will come in and joke and say, oh, that sounds nice, hyperthyroid, that sounds good. And I would say, no, actually it's not good, although the thought of having more energy is good. When you're talking about hyperthyroid, this isn't, oh, I feel so energized. This is an overstimulation of the system, hence the danger of the emergency state that we're talking about. The other thing I wanted to mention is that we talked a little bit last time, and we're going to talk about it again here on the next page about labs. I just want to remind you that you may not have your hypothyroid state already developed, but you can have Hashimoto's present.
Absolutely. And that's a great point. I'm glad you brought that up. From a lab standpoint, well, let's just get to the labs. From a lab standpoint, the three main labs that we will look at are anti-TPO, anti-TG, and something called TSI. Now, these top two are for Hashimoto's low thyroid, and the bottom one tends to be very specific for hyper-high thyroid. However, what I was going to say is that many patients, I think this is what Dr. Bosch was saying, many patients will present with these antibodies being elevated, but the rest of the labs look normal, and then, of course, the conventional doctor will just say you're fine.
You're fine, yeah.
Even though there's something clearly going on in the thyroid gland. There's that autoimmune process is taking place. There's other causal reasons for even why you have that issue, and there's damage going on to the thyroid gland, but they often just simply do nothing until they see other parameters look bad.
And the reason that's important is because, again, if you are being an advocate for your own health, which is what we're asking, then make sure you request from your doctor your autoimmune panel to be run as well. Because if you do have your antibodies present, even if your thyroid panel comes back normal, then this is a wonderful gift of foresight. It's like that flashing yellow light that's saying, danger, danger, somewhere along the road, you may truly develop an overt hypothyroidism or hyperthyroidism.
Yeah. And let me say, too, that we routinely check these top two for any new patient coming in. Automatically, anti-TPO and anti-TG will be checked. Anti-TPO, if a conventional doctor checks, they may check anti-TPO. They often do not check anti-TG. We check, again, both. But if it's specific, we start to think hyper-high thyroid. If there's some suggestions, maybe some other labs or some clinical things going on, fast heartbeat, shaking, things like that look like a lot of rapid weight loss, then we may look at the TSI then, and that can be very specific. So what do we do from a thyroxone standpoint? Remember, thyroxones are a unique system on how we approach thyroid disease. And so some of the things are RMR and Thyroflex. Again, we talked about that last week. This is just a resting metabolic rate assessment. Also the Thyroflex looking at the reflex speed of your wrist. But thermograph, that's a little different.
Yeah, so thermogram or thermography is this great tool that we do in office that is essentially taking a picture of the thyroid, in this case the thyroid. You can use it for the breast or other parts of the body as well. But what it's looking for is an increase in vascular activity to an area. The reason this is important is because a person will often have neogenesis, is what I was going to say, neogenesis or new blood cells forming in an area where perhaps there's a little bit of a tumor forming. A tumor is essentially any rapid cell growth that's getting clustered together. So you imagine the way a tumor goes from small to bigger, it needs a lot of supplies being transported into that area, and that happens through the bloodstream. So a thermograph is looking for signs of general inflammation and definitely for increased vascularization to pinpoint areas that can be alarming.
Yeah, so we could actually use this as a screening tool to see whether or not there's that activity going on in there, despite what's going on with labs. But then certainly a monitoring situation. Is the inflammation in the gland itself improving over time after treatment? Yeah. So it's a really unique thing, and it's definitely something we offer here at the Hormone Zone with our unique system called Thyroxone. So we encourage that, and also again breast health as well, and some other things that it does too.
Right. And just one more point on the thermograph is that it's a photograph, literally. So there's no side effect.
Heat image, yeah.
There's no side effect profile. There's no compression. There's no discomfort to the patient at all.
No radiation.
There's no radiation. Very important.
Yes. So. Okay, so we've maybe got a diagnosis at this point. So what are we going to do to treat it? So I've got two kind of things here. We're talking about Hashimoto's treatment and then sort of Graves' treatment. A lot of the focus is going to be on Hashimoto's. Again, we're going to see that way more common. Probably 90%, if there's going to be an autoimmune process with the thyroid, it's about 90% of the cases will be low thyroid with Hashimoto's and about 10 being hyper-high thyroid with Graves'. But what do we do to treat it? If somebody's got this Hashimoto's problem, let's say they have issues with these antibodies being elevated, what do we do? Well, one of the first things is we want to look at T3, right? That T3 medication, whether that's through synthetic T3 or something we tend to use, Natrothyroid.
Which we did talk about last time as well. Again, take-home messages here are the right thyroid medicine is the one that's right for you. And the other thing to consider for those of you that are already being treated for your thyroid conditions, if there is no T3 therapy there, please make sure you ask for it.
Yes, for sure. And again, being your own advocate, just like you said. So low-dose naltrexone, this is something we're really excited about. Absolutely love this medication. It's been around since about the 1980s. It's as naltrexone. It's FDA approved at 50 milligrams. And it's normally used, interestingly, for people who are addicted to opioids, maybe like heroin. So I always love to say that first to patients, and they go, well, why the hell does he want to give me this? And really, it's because what they found back in the 1980s, they were studying this quite a bit, and this particular doctor out of New York figured out that if we gave low doses of this medication, somewhere in the range of about 3 to 4.5 milligrams, if we gave low doses of naltrexone, it would kind of suppress the endorphins, but give you a little bit of a rebound of endorphins that then was modulating to the immune system. And it was treating all kinds of autoimmune conditions at the time. He was particularly studying multiple sclerosis and Crohn's disease, two very common autoimmune conditions. So it kind of went away because, of course, new medications come out, so they just kind of went out of vogue. And in about the past decade, we've seen a resurgence. So I encourage everybody to go to lowdosenaltrexone.org. Excuse me.
Research.
Thank you. What is it?
LDN Research?
Thank you. ldnresearchtrust.org. Thank you.
Low dose naltrexone.
Right. ldnresearchtrust.org. And you see all kinds of great information there. In fact, they have scientists and doctors come from all over the world once a year to be able to speak on LDN and what it can do for all kinds of things in autoimmunity and other things. And in fact, they'll be speaking in September in Seattle.
Seattle, yes.
No, in Portland.
Portland.
In Portland.
Sorry.
Somewhere over there. And I'll be speaking on what we're doing here at the Hormone Zone. We're all doing here at the Hormone Zone using LDN and how it's affecting Hashimoto's and even Graves' disease. So really excited to present that.
Yeah. So when you go to research on your own a little bit more about naltrexone, make sure you're looking at LDN specifically or low dose naltrexone. It's a completely different body of research. And this has been particularly useful for me in working with patients that are having infertility issues like difficulty with conception, but then also with high incidence of miscarriage, which tends to be common in patients with Hashimoto's. Even Hashimoto's patients that do not have hypothyroid will have an increased incidence of miscarriage. So LDN is just a really beautiful, very effective medicine that has been, well, life-saving for many of our patients.
Absolutely. And you know what's great? There really isn't a huge side effect profile that goes along with it. One of the side effects of it that people say they have a better sense of well-being, which is really kind of exciting. Right. Maybe the worst of it we hear is vivid dreams if they take it at night, because it really can help to relax you. They're using this with autism, all kinds of autoimmune conditions. It's really exciting stuff. For us, we're using it here specifically to help start modulating what's going on with the immune system and bringing down some of those antibodies, and we're starting to see some results of that.
So what we didn't talk about was iodine.
So this would be the treatment for Graves' disease.
But we use iodine for any thyroid condition.
Absolutely.
And the reason I'm bringing our attention back to iodine is because just to bridge the concept of labs, some of these labs that other doctors may say, well, why do you even need that? It's not so important. This is where the insight that the labs are giving you, this is information your body is providing. Literally, your body has the wisdom. All we need to do is ask and then try to interpret the information. So iodine is going to be a wonderful nutrient tool versus a pharmaceutical one, even a natural pharmacy, that is going to help improve reducing inflammatory reactions as well as increasing your thyroid function.
Yes. So specifically, well, let's come back here to Hashimoto's in terms of treating some of the cause. And actually this does address the cause of Graves' disease as well. Now there's several things. But we've narrowed it down to a couple just to talk about it briefly. Food allergies is right at the top of the list.
Huge.
And of most food allergies, probably wheat is the biggest culprit that we've associated with Hashimoto's and Graves' disease, any kind of autoimmune thyroid disease.
Yes, and notice that John said wheat, not just gluten. It's a very important distinction. Some gluten-free products still contain wheat particles in it. So in general, grains, if we're going to take it and be a little bit bolder, but for sure wheat and gluten.
Barley and rye and these kind of things will kind of encompass what's going on with wheat. But there could be, maybe you're fine with wheat and there's other food allergies that are going on that's causing that inflammatory process and the overproduction of immune reactions. So, and of course toxicity, and this is a big thing we see. You know, we always say something we learned in medical school, it's not a matter of if you're toxic, it's just a matter of how much and how much that toxicity is negatively affecting your health. So we want to take a look at that as well, and we do. So, and that would be the same thing again for Graves as well. We want to look at these causal things But specifically back up to Graves and iodine, these are medicinal amounts of iodine that we're using here in milligram amounts, and it's great research behind this in our first book, The Hormone Zone. The light just went. There we go. In our first book, The Hormone Zone, we do talk about iodine. In fact, there's an entire chapter devoted to iodine alone. And in terms of how they historically were using it for high thyroid and Graves' disease very, very successfully if you were just giving enough of it. So whenever you're dealing with Graves' disease or hyperthyroid, it needs to be monitored very, very closely by a physician. If you're going to be using iodine, you've got to be monitored.
Super important, especially again, we're talking about milligram dosing. So you may say, oh, I'm taking iodine. Oh, that's great. Look at me, I'm taking iodine. But those are microgram dosing. There really is a difference between the micro and the milligram dosing. So it's very important what John is saying. Just make sure that you're being monitored by someone who you would consider an expert.
Absolutely. Okay, so what's next? Oh, the fun part. So every week we talk about the artisans of sex, and this is bridging the sort of art and the science together. And as we are known as the sex docs, we often will bring these things back to sex. I think today it's going to be a little bit about sex in terms of gender. I think we'll be talking a little bit more about
that's a good
today.
way to say it.
So the science, and so this is the artisans of sex as it relates to Hashimoto's, Graves' disease, and autoimmunity in general. And so we tend to see, this is a very interesting stat, the likelihood of having any kind of autoimmune condition is 9 to 1 in women to men.
It's alarming.
That is. That's quite a bit more. So you can see way more women having some form of autoimmunity. Remember, multiple sclerosis, Crohn's disease, lupus, Hashimoto's, Graves' disease, and many conditions we're seeing not even just the classic autoimmune, but we're coming back and saying miscarriages and all kinds of things are coming back to some sort of autoimmune condition, and unfortunately we're seeing it far more in women than we are in men. So what are some of those reasons? And there are a lot of them, and frankly the science hasn't really given us a definitive answer, but some of the suggestions would be, and certainly what we relate to here at the Hormone Zone, is toxicity. And I think with women maybe, they're using a little bit, maybe being exposed to toxicity more, makeup, hair products, right?
Exactly. The beautification process is one that we don't think about, that literally the greatest exposure of toxins are things that you can easily control. Yes. And it's either by minimizing or simply cleaning up the products that you're putting on your body. And on your little ones. Absolutely.
And it's often, look, we've been involved with this, health gig for a lot of years, and there's been a lot of products, and we've been going to Whole Foods and these kind of places for many, many years now. And I think some of the things when you want to try to replace what you're used to, whether it's a toothpaste or whatever it is, and many of those things can be kind of gross, but it kind of used to be. I don't think it's so bad anymore.
They've gotten better.
Yeah, they've gotten a lot better.
They've gotten better. And then you can't say things like, oh, I bought this at a natural grocery store, therefore that means it's good.
Right.
I mean, you've got to be educating yourself. But that in and of itself is an incredibly overwhelming process. So keep it simple.
And get some guidance.
For sure.
So menopause, that would be another common reason why maybe we're seeing issues with women having more of these autoimmune conditions. What estrogen does is it modulates the immune system. And as estrogen levels go down through menopause, you're not having that level of modulation. Also testosterone in a huge way. That actually calms the immune system down. So women tend to have this sort of overreaction in their immune system, and testosterone has sort of a suppressive, not in necessarily a negative way, but androgens have sort of a suppressive modulating effect, and we can see that quite a bit. I've seen that many, many times over the years. People with psoriatic arthritis, psoriasis in general, have that toned down just by testosterone replacement therapy.
So what's that, like reason number 5 gazillion for why women need testosterone?
Sure, absolutely. That's chalk it up to a number. Yeah. So what about the art?
Well, I always bring it back to sex, regardless. Not just gender, but, sex. Let's talk about what this means. I mean, if you think of the word autoimmune, and you think of, when we're talking about an immune reaction, I want you to imagine inflammation, reactions, okay? Women in general just tend to be more reactionary. It's a pro, it can sometimes be a con, but from a positive perspective, this is a very feminine energy. This is a feminine quality that allows us to be that much more nurturing and sympathetic or empathetic and loving and selfless. So if you're thinking about autoimmune, it means that you're having a reaction to yourself. What a incredible concept to think that perhaps the choices you're making and the thoughts that you have and the feelings you hold in your heart could be triggering an actual health crisis. So when you're thinking about autoimmune reactions, and you're thinking mostly about the female, although this does apply to the male as well, I want you to remember that this notion of being kind to yourself, loving yourself, being in love with yourself, sexually appreciating yourself, and all of the other concepts that we so passionately discuss here as the sex docs is a really big key, something you can do right now to help calm down that autoimmune reaction in your life.
And, being good to yourself. And also we talked last week about the thyroid speaking your truth. And I think one of the ways to kind of get to that point where you're being good to yourself is speaking what it is that you're thinking and feeling. Sometimes maybe women are having issues with that, but I got to say men have that issue a lot too. So speak what it is that you are thinking and feeling. Maybe get rid of some of that shame and just be kind to yourself.
Or criticism. I mean, I don't know, perhaps shame, although it's appropriate sometimes, is a loaded word for people, but there's self-criticism in everything. Just think about how you assess yourself when you take a selfie. That in and of itself is a good indicator perhaps of how kind you're being to yourself.
Do you ever do that?
No!
It takes us like an hour to do one selfie. Sometimes.
Because of me?
Well, because you want to reposition, you want to make it perfect.
Yeah.
She's poking me again under the table.
No, this time I'm just squeezing him painfully.
I can take it.
I know you can.
All right, so...
Question for you.
Yes.
We had a couple questions. One of them I can see on the screen right away. Would you like to address that? It's about a gluten-free diet as a necessity for Hashimoto's.
A necessity. A gluten-free diet as a necessity. I think most of the time, at least the way I tend to answer things, whenever it's always or must be,
Agreed.
that I tend to shy away from that concept
agreed.
just sort of intellectually. But with that said, I think it's a heck of a place to start for a lot of people.
Yeah, I mean, if we're going to be asked for black and white answers, then in this case I would say yes. But I agree with John. I don't like extremes. I think what's important here is not about it being a gluten-free diet, but about how are you minimizing the burdens in your life. We talked about cosmetics as one of those things, or soaps or toothpaste. Gluten is definitely one of those, especially since gluten and wheat are such an addiction. That's a whole other chapter that I don't want to delve into too much now. But to answer your question, Dolores, I would say it's not an emotionally easy thing to do, but philosophically, yes. Start going gluten-free, start going wheat-free, eventually start going grain-free, and you'll see how much better you can do to help manage that Hashimoto's process.
That's a great point. One of the tests that we use here is called the wheat zoomer. And I've had that test done. And this is a very specific way of looking at wheat, the different types of gluten, gliadin, glutenin, and some other factors. That it's really, really a very excellent test. I had the test done, and I hardly had anything. It was basically no reaction whatsoever to gluten, to non-gluten wheat proteins. Everything was fine. And in general, I can sort of get away with wheat. With that said, when I tend to stay away from it, which most of the time that's how we tend to practice in terms of lifestyle, I just feel better. So even though I didn't have any kind of reaction with that. Some people are maybe a little bit more hyper-reactive to gluten, and they definitely need to, stay away no matter what. Christina is the one-bite rule. She can't even stare at gluten too long.
No, I don't know that we have enough time, but I'm gonna indulge myself anyway and say, so we keep paleo at home for the most part, and I definitely go gluten-free, I would say 90% of the time. On Mother's Day before brunch, I decided to have a donut as an appetizer. There's reasons, including the smell of the brand new shop that opens near where we were eating. Either way, the point is, I hadn't had wheat in a really long time. I ate a couple bites out of that donut.
Maybe two.
And it was like it awoke this sleeping giant of addiction. I really can understand when people say, I fell off the wagon.
Yeah.
Is that the case?
Yes.
I fell off the wagon. It took me a month. I mean, I'm still recovering, but it's literally taken me a month to not have this profound, intense, emotional, and psychological craving for weed. And instantaneously, I felt terrible.
And the things that we normally crave the most are the things we are normally the most allergic to. And you're, according to her particular test, and we knew it already, but her test was like, It was fantastic to look at from a sort of science dorky standpoint, but yeah, it confirmed very much what was going on, and it's helping us continue to guide our patients too.
So we'll get to those labs and those topics as we go, but I think the important thing is there's lots of great tools out there. The more scientific data we believe that you can learn about yourself, it's almost like reading your horoscope, it's insight as to who you are, then I think usually the easier it is to commit to changes, because it's an easier way to get your heart and your brain on the same page of commitment to this is a healthy lifestyle I choose to live in general as an always kind of rule.
This is one way we define medicine. Medicine is anything that helps you to understand a little bit more about yourself.
Yeah.
So, with that said, too, here's what we definitely know for sure.
Hormones are sexy.
Life is sexy. My wife is definitely sexy. All of this stuff is sexy. Facebook, you're all sexy. Thank you so much for watching. Next week, we're going to round this all off with thyroid and fat loss. Yes, thyroid and fat loss. So why am I so fat? Why am I still getting fat despite exercise and all that? We're going to talk a little bit about that next week, Tuesday, 12:30 Arizona time. See you then, Facebook.
Have a wonderful week.
Bye.